The humerus is the longest and largest bone in the upper limb. It extends from the shoulder to the elbow. It is a typical long bone with three main parts: the proximal end, the shaft, and the distal end. The proximal end of the humerus features several important landmarks. The head of the humerus is smooth and spherical. It articulates with the glenoid cavity of the scapula to form the shoulder joint. The anatomical neck is a slight constriction just below the head. It marks the attachment of the joint capsule. The greater tubercle is located laterally and it serves as the attachment site for the supraspinatus, the infraspinatus, and the teres minor muscles. The lesser tubercle is positioned more medially. It is the point of attachment for the subscapularis muscle. The intertubercular groove, also called the bicipital groove, is situated between the two tubercles and it houses the tendon of the long head of biceps brachii. The surgical neck of the humerus is a common site for fractures. It lies just below the tubercles and is the transition to the shaft. The shaft of the humerus is roughly cylindrical proximally but flattens distally. Key features include the deltoid tuberosity, which is a roughened area on the lateral aspect where the deltoid muscle inserts. The radial groove, which is located posteriorly and transmits the radial nerve and the profunda brachii artery. The distal end of the humerus widens and presents important landmarks for articulation and muscle attachment. The capitulum is a rounded lateral structure which articulates with the head of the radius. The trochlea is a pulley-shaped medial structure which articulates with the ulna. The medial and lateral epicondyles are bony projections for muscle and ligament attachments. The coronoid fossa is located anteriorly and accommodates the coronoid process of the ulna during elbow flexion. The radial fossa is a small depression that receives the radial head in flexion. The olecranon fossa is a large posterior depression that accommodates the olecranon process of the ulna during elbow extension. The humerus forms two important joints: the shoulder joint, also called the glenohumeral joint, where the humeral head articulates with the glenoid cavity of the scapula, and the elbow joint, where the humerus articulates with both the ulna and the radius. The humerus plays a crucial role in the mobility and function of the upper limb. Understanding its anatomy helps in diagnosing fractures and nerve injuries.